Hello mga gao! Here in this video, I'm gonna speak in English because it is the global language. And for those who don't know me, I am a Filipino nurse and English is my third language. So please bear with my English. Thank you. As you can see, I am recording this video inside my room because here in the Philippines, we are put in a community quarantine. And also, it is a tropical country, so I'm wearing a tank top, so please forgive my attire. Anyways, people all over the world are panicking over COVID-19, and understandably so. Citizens are hoarding food, personal hygiene products such as soap, alcohol, hand sanitizers, and quite surprisingly, toilet paper for some reason.
Let's get ready to rumble!
The problem with this behavior is that this supply hoarding only causes more health problems and mass hysteria, all because of lack of health education. In order to combat COVID-19, we must have a proper understanding of what the nature of a virus is. And in so doing, we would have an educated approach on how to handle these kinds of microorganisms. Tip number 1. Avoid crowded places. Why? COVID-19 is a new type of coronavirus which causes a wide array of illnesses which are commonly respiratory diseases. Since it is a virus, its nature is to attach to a healthy cell of a living organism, in this instance from animals such as pangolins and bats, towards humans. A virus is parasitic in nature. In order for it to replicate, a virus must need a new host cell to transfer into. Viruses are self-limiting in nature, so if you are going to eliminate its chance to transfer into a new host, it will die out eventually. Tip number 2. Practice good hygiene. Washing your hands with soap and water or using alcohol-based products may kill viruses that may be in your hands. So these are all external. So drinking alcohol uh, actually doesn't help because viruses are in cellular in nature, so you cannot just drink alcohol to kill those who are already in your cells. So that's actually a lie. Tip number 3. Maintain social distancing. Maintain at least 1 meter distance from yourself and anyone who is coughing or sneezing. Why? COVID-19 or any type of contagion needs a mode of transmission for it to infect another person. So, when someone coughs or sneezes, they spray small liquid droplets from their nose or mouth, which may contain a virus. COVID-19 is transferred via droplets. So if you are too close, you can breathe in the droplets, including the COVID-19 virus, if the person coughing has the disease. Tip number 4. Avoid touching the eyes, nose, and mouth. Why? Hands touch many surfaces and can pick up viruses. Once contaminated, hands can transfer the virus to your eyes, nose, or mouth. From there, the virus can enter your body and can make you sick. England's Chief Medical Officer Professor Chris Whitty advised that the COVID-19 infection can remain on buses and trains, handrails from malls or any kind of public surfaces up to 3 days. However, he said they could be largely gone within 48 hours in most cases. Tip number 5. Practice respiratory hygiene. Make sure you and the people around you follow good respiratory hygiene, especially when you are going to cough or sneeze. This means covering your mouth and nose with your bent elbow if you don't have a handkerchief or tissue when you cough and sneeze. Then dispose the used tissue immediately, most preferably in a closed bin. And if you are exhibiting symptoms, use a face mask. Do others a favor. Keep it all to yourself, all right? Why? Droplets spread virus. By following good respiratory hygiene, you protect the people around you from viruses such as cold, the flu, and of course the COVID-19 virus, especially those who are in the risk groups such as the immunocompromised, the elderly, and the children. If you are coughing and sneezing, please do others a favor and wear a mask. What I have here is a surgical mask. It is disposable in nature. Um, Surgical masks have different types. Others have colored surfaces for easier indication where the outside surface is. But what I have right here now is full white in color. But all types of surgical masks have a metal mesh on it. It is an indicator to which where the outside surface is located. So all you have to do is find where the metal mesh is protruding most. It means that's where the outside surface is located. So in wearing the surgical mask, all you have to do is put the mask in your face, pull the strings to the back of your ear, and then adjust it by pulling it downwards. And when you are going to feel that it is already snug, not too loose, not too tight, then all you have to do is just pinch the metal mesh on the bridge of your nose, and then you're done. Tip number 6, recognize the symptoms. Symptoms include high fever, dry cough, difficulty of breathing, and diarrhea. If you have traveled to countries that have positive cases of COVID-19 or have been exposed to people who have positive cases of COVID-19, here is a diagram in Bisaya of how to recognize the symptoms and what to do. Stay home if you feel unwell. Seek medical attention and call in advance. Follow the directions of your local health authority. And here is a diagram from the Department of Health if you opt for home quarantine. Tip number 7, stay informed and follow healthcare advice from your healthcare provider. Why? National and local authorities will have the most up-to-date information on the situation in your area. Calling in advance will allow your healthcare provider to quickly direct you to the right healthcare facility. This will also protect you and help prevent spread of viruses and other infections. The regional PNP COVID-19 hotline number is under the video. Tip number 8. Avoid hoarding personal hygiene products. Why? You need other people to be healthy also to prevent spread of disease. This is not a singular effort, it's a community endeavor. Tip number 9. Boost your immune system. Having a strong immune system makes you less susceptible to diseases. So here are the 8 tips on how to boost your immune system. Tip number 1. Reduce your stress levels. Chronic stress suppresses the immune response of the body by releasing the hormone cortisol. Cortisol interferes with the T cells and reduces the antibody secretory IgA, which lines the gut and respiratory tract, which are our first line of defense against pathogens. Tip number 2. Moderate your alcohol intake. Numerous researches have shown that excess intake of alcohol can tamper with the immune system in its pathway in a complicated manner. However, moderate consumption of alcohol can be helpful to the overall health of the body. Tip number 3. Make sure you get your vitamins. Vitamin A, B6, C, D, and E can help increase the strength of the immune system. Vitamin C is the biggest booster of all. You can get vitamin C from citrus fruits like oranges and lemons. Tip number 4. Eat more vegetables. Vegetables, fruits, seeds, and nuts are loaded with nutrients that are essential for our immune system. Tip number 5. Get your exercise on. Working out on a regular basis has been scientifically proven to boost the immune system. However, continuous rigorous workout weakens the immune system. Tip number 6. Get sufficient sleep. Lack of sleep can cause the inflammatory immune response to activate, reducing the activity of T cells in the body. This can weaken your immune system and response to vaccines. Try to sleep for 7 to 8 hours and avoid having an all-nighter. Tip number 7. Stop the habit of smoking. Stop the habit of smoking because not only does it increases the risk of cancer, but it also impairs the immune system. And lastly, step out in the sun. Stepping out in the natural light is one of the major contributors to the production of vitamin D in our body. Vitamin D is essential for healthy functioning of the immune system as it helps the body to produce antibodies.